tàṣà gbígbé lárugẹ àwa la nìyẹn. Ẹ̀sìn gbígbé lárugẹ iṣẹ́ wa ni. Eré ìdárayá ọ̀rọ̀ tó ń lọ ojúṣe wa nìyẹn. Ká kọ́ni lọ́gbọ́n, ká fúnni lóye, ká tún dáni lára.
Channels, and we are presenting you Health Talk. In Nigeria today, in fact, across Africa, we know that the major sickness of many homes is malaria. For a layman like myself, when you ask me about malaria, I'll tell you it's caused by mosquitoes and the likes. Today with me is an expert, a pharmacist, somebody in the medical lines. The person will be able to tell us a little bit more about malaria than I will tell you. Here with me is pharmacist Abiodun Taofeek Bakare. You're welcome.
Thank you very much, man. Greetings to our viewers and listeners.
Thank you. Yes, today we are going to ask pharmacist Bakare to tell us one or two things about malaria. Can you just tell the viewers and the listeners a little bit about causes and effects of mosquito bite, or what actually leads to malaria?
Thank you very much. Malaria is defined as a life-threatening disease that is caused as a result of transmission of a parasite called Plasmodium species. And this transmission usually involves a vector. And unfortunately, that vector lives with us. That is female Anopheles mosquito. That is the agent of transfer or transmission of the causative organism of malaria, which is Plasmodium, into an uninfected person through biting and sucking of blood. When that parasite gets into the blood system, it is transferred to the liver, where it undergoes maturity. So after a few weeks, it goes back into the system, into the bloodstream, where it does a lot of damages to the red blood cell, which is very important in the transportation of nutrients and oxygen throughout the body. So through the same process, it gets to other organs of the body where more damage can occur. And that's why it is very important to know how to prevent malaria, because we say the cost of prevention is always better and cheaper than the cost of treatment or cure.
Thank you, Pharmacist Bakare. You just mentioned something about the liver after the female. Why is it that is the female that is so important or so terrible that it goes into it does the biting? I don't know.
I think that is the universe in action. You will notice that usually, even among higher animals like the cats,
Okay.
it is the lioness usually that does more of the hunting. The only thing that the male mosquito does is the buzzing, just to around your ears to know whether the person is fast asleep or is still active.
Really?
So, yes, that's what the male does. The one making noise usually are the males. Okay. So the one doing the sucking is the female.
That's interesting. It's Quite interesting. I'm learning, and I'm sure our viewers at home and listeners are actually learning from this. Uh, that the male would go about testing whether the person is asleep. No wonder the noise is always so high.
The males are caring
Why?
too, they are caring, you are always,
Yeah, and
it's always
the
like that, even in higher animals.
that's interesting. Yeah. So before we go further, I want to know how we actually can prevent all this. Oh, is there more you want to tell us before we start talking about
Yes, so,
the?
so that to really show how important is, you know, for us to understand this disease and how and the prevalence in our society
Mm.
and the effects on our, living. It is also necessary to, let us see the statistics. That the last statistics was in 2020 that about 240 something million, people were infected, had malaria,
40
disease.
million.
240 million. And out of that 240, where our continent, Africa, where it is most prevalent, had about 90%, 95% of that, of the disease. And that out of that 240 million, about 250,000 deaths actually occur. And that is quite, enormous, quite huge. So a lot of people underrate this, disease. But it is also important, very important for us to know that it is also, has fatality, rate. They can also kill. Recently, one of the Nollywood actors in Ikorodu, he said he died of malaria. That one,
Yes, and
the
people,
jaw,
yes, and
the
people
jaw.
were wondering
People
how
are wondering that,
malaria.
so if it shows that it doesn't matter your status or whatever, and it is a disease that, if not well treated, it becomes complicated and can also lead to death. So that is why we need to stress that, and that among the risk people who are traveling from low prevalent, region to high prevalent, like from Europe to Nigeria, it's important, you know. The children less than 5 years, they are more, at higher risk. Pregnant women are also at, higher risk, and those are important. Then adult people too; those are the important people that, the society, hold the responsibility of taking care of. They are one of, the major people, apart from the youth. The other category, the categories of people that we have mentioned are, also very important.
Yes, thank you very much, Francis Bakari. You mentioned pregnant women and children. Why is this so? Why is there? Uh, is it because of low immunity, or I don't know? Maybe you can enlighten us more.
Like, yeah, for the children, that one's it's quite obvious that they still have low immunity, because immunity against this thing, is a matter of our exposure to it over time. So the level of immunity of the children, they are still, lower than someone who has been, frequently, been exposed to this disease. The more you get exposed to something, the more you become resistant or immune to it. Yes. So for the pregnant women, of course, it is, due to, immunity and some other factors like the, presence of, high level of sugar in the system, with that, becomes an enable, a growth environment for the parasite. Then where it is also important to take care, because it can also be transmitted down from,
The
from
mother
the
to the
mother
unborn child.
to the unborn child, and that can be fatal too, because it can lead to you know, low birth, weight. It can lead to even before the, threatened abortion as a premature
Mm-hmm.
labor.
Yeah.
Mhm. So giving, birth to preterm, baby.
Mm. No wonder organizations and some sets of people in this line are always conscious of pregnant women and children. Now we know. Viewers, I hope you are learning. Don't tune off. Let's continue to listen to pharmacist Abiodun Bakare. He's the head of
Regional sales manager for
okay,
Drug Pharmaceuticals Limited.
okay, regional sales manager for drug field pharmaceutical uh,
Limited.
limited. Once again, you're welcome. So, what else do you think you can tell us so that novice like me and some of our viewers who are like me will learn?
Um, Basically, based on the severity of the symptoms and signs, it is malaria is classified into two major you know classes: the uncomplicated, uh, the mild one, and the complicated or the severe malaria.
That's another one I'm learning.
Uncomplicated and complicated. The uncomplicated are the regular experience that normally starts with feeling of coldness and chill in the patient. Start with that, then it graduates to fever, high temperature, muscle pains, headache,
Hmm?
then goes down to sweating. Some will say loss of appetite, tastelessness, and so that's the uncomplicated, uh, symptoms or symptoms of the uncomplicated level or class.
Mm.
But for the complicated, because the disease has moved or the parasite has moved, they call it invasion, has invaded, major organs. So manifestation of, you know, the consequences of the invasion are what we see in complicated malaria. For instance, breathlessness, because the lungs has been, invaded,
Invading.
and certain normally when there is invasion like that, there will be irritations and there will be inflammation. And when there is inflammation, it will affect the capacity of the
Breathing.
yeah.
Mm.
So you might have breathlessness. You can also have low BP.
Really?
Yes, and that can also be low hypoglycemia, low level of sugar in the system because of the fact that metabolic activities has been, destabilized.
Mm.
So then the another one that is quite fatal is the cerebral malaria, as when the blood vessels that feed the brain has been, invaded, such that there's no enough supply of oxygen and nutrients you know, to the brain. You can have delirium, can have unconsciousness, can also lead to coma. So you can see that these are complicated. And after that, we talk about death.
Wow. Hmm. I'm learning, except that there are some um, names you mentioned, some terminologies that are well above my head. In any case, I think some of us are still learning despite that. Some people refer to malaria, will say they have malaria fever. How do you explain that? Some will say it's high fever. Can you just give us an insight into malaria fever and
Uh,
high fever?
well, it is allowed that colloquially or locally, people are allowed to use their language, to communicate in the
Look,
simplest way. But I'm going to talk about what
because
they
a
mean by
lot of
this.
us will say malaria fever
Fever.
and malaria this high fever. You find a lot of people, if you just say what's wrong with you, say he has fever.
Fever is simply the high in temperature, scientifically speaking.
Okay.
Let's say you have fever, it can be here, it can
The
be on the body,
temperature
it
has
can be
gone.
on your head, it can be
So
anywhere.
when temperature goes up,
That's
it's fever. All right.
Now, when they now say malaria fever, they are saying that that temperature because of the fact that our people they know how to diagnose. We give it to them that
Yes.
this fever is due to
Malaria.
this increased temperature is
Due
as
to
a result
malaria.
of malaria
Okay.
infection. So it is allowed. We permit them. That does not distort or affect the professional practice.
Okay. So once they say that, if I come to you and say I have malaria fever, you know it's not malaria fever. It's not called malaria fever. You know what is actually wrong.
Yes.
Okay.
So it is because it is only after I've done diagnosis that you can precisely say this is what is wrong. So anything can be responsible for fever. Even in the ordinary cold can raise the temperature.
Mm.
During the COVID, temperature is part of
Yes.
they're always testing us with. So if you now believe if you are having COVID and you think it is malaria until we do the test. So
And the same thing applies to high fever.
the one they call high fever is when it has gotten to the complicated level where I said that the blood vessels feeding
Yes.
the brain has manifested. So you see some restlessness, some form of incoordination, imbalance,
Yes.
and unconsciousness sometimes. So you know that this has actually got into the central nervous system, because that is
Okay.
part of the body system that controls anything that has to do with coordination. You understand?
Yes.
Brain work.
Okay. So, how do you, now you've told us all this information about malaria, how do you contract? Okay, you've told us it's through mosquito bites. So how do we prevent mosquitoes from getting around us or from biting us? Especially that one that will sing and you have to slap yourself or box yourself a lot of times.
It's there are pharmacological and non-pharmacological, as use of drug and use of non-drug approach. The non-drug approach of the preventive measure is actually about 3 or 4. Let's say 3. That's use of insecticide, treated malaria nets,
Okay.
use of insecticide spray,
Mhm.
and use of repellents, mosquito repellents.
Okay.
So as long as that thing does not get to you, whatever will prevent that thing from coming to you, physical form or chemical form, is in that category. Like that gel, there is a particular product, electro gel, that's one of the good, apart from repelling the the vector, the mosquito, and even other insects. It also has soothing effects on the body. You know what the gel does to the body. So instead of you sweating or blocking it does not block the 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 pulse.
The pulse,
It's
okay.
also it just gives you more comfort after using it, unlike the cream.
Okay.
So having said that, the use of drugs is also very important, especially for some categories of people that we know that they are highly vulnerable. Like we mentioned, the pregnant,
Pregnant and the children.
but they have time. There are 3 trimesters in pregnancy. They are based on the weeks and what happens. The first trimester is the most critical time that organs are being, formed.
Four.
So, and at that point, nobody can assure, nobody is ready to play with the safety of that fetus. So it's not allowed to use drug that time.
So what do you use?
So it is the preventive that's, once you take, care of more, you use more of preventive, the physical preventive, nets, the repeller, the spray. But when you get to second trimester, the first trimester is about the 0 week to 13. Then the other one, second trimester, 14 to 26, 26 to 40 weeks is the gestational period. So that's the second trimester. They call it intermittent malaria treatment in pregnancy.
Okay.
So that made that second trimester, they made this minimum of at least 1 or 2 months after the first dose, use another one to prevent that malaria. What that one does is clears the malaria in the system so that the baby and the mother will be safe. Then for the children of less than 5 years that we mentioned earlier, and maybe places where it is prevalent, we can do seasonal preventive measure. Sometimes it is perennial, like the programming that we normally do every Sunday.
Okay.
Sunday. Some people take that drug to prevent malaria. There are some that's every month. There are some that's during the season of prevalence. I think this is the time to talk about, to do it. So that then people traveling, once you enter, before you start coming, you start taking that malaria. Somebody is coming from UK, you must start taking care of himself maybe 2 weeks before, and throughout the stay, then maybe 2 weeks after it goes back.
You mean you can be taking anti-malaria throughout a period of time?
Depending on, there are different categories with different profile, different safety profile. So it depends. Like that program I used to take in those days every Sunday.
Yes.
If it's not safe, we'll not be taking it every Sunday.
Exactly.
So there are some that are safe, even safe in pregnancy. There are some that are not safe in pregnancy. So
I'm sure viewers out there, you are enjoying the program, and I'm sure you know what malaria is all about, the kind of effect it has on the body, especially on the pregnant women and children. We have to be very careful. We have to think about the preventive measures. That's the use of some repellents, treated mosquito nets, and taking care of your environment.
yes.
Am I right?
You're very
Yes.
correct.
So when you do that, you clear the bushes around your home, you spray, you use treated mosquito net the way it should be. Can you just tell us how we should use treated net? Because I believe a lot of us don't know how to undo treated net. Is this something you just remove from the pack and cover your bed and you start sleeping underneath it?
The approach that's is meant to be applied is first to spread it, outside, for a little time, then before you start applying. But you know what our people are? We are special species, and we are always in a hurry. And we look at we are always covered, with grace.
Yes,
Special
and the
favor.
blood of Jesus, inshallah.
Look at the miraculous way we survived Ebola and COVID.
Yes.
So our people are always covered, but it is enjoying that we do things the way it should be done.
Yes. Thank you. So let's talk about You've talked about the preventive. What about the treatment
Yes.
of malaria?
The, after taking all those preventive measures, it's still possible that one still gets down with malaria. And there are a number of uh, the first thing is to to be sure that one has malaria, the patient has malaria. That's why diagnosis is very germane in the management, so that you don't start treating you know maybe the a fungal infection, or let me say a bacterial infection, instead of treating malaria or otherwise, or vice versa. So after doing that diagnosis, the malaria parasite test.
Who does the diagnosis?
Uh,
Do I have to go to the hospital, or a nurse, or even I could come to any of a pharmacist? I could go to a chemist, even a patent medicine store, and tell them I have malaria, or the nurse will see me, or I just tell the nurse I have malaria, or the nurse will just see me and say, "Oh, you have malaria," and start treating.
Luckily, by most health, practitioners, nurse, pharmacists, and doctors, you know, they are capable.
Yeah,
They have the knowledge and the training on how to handle some common diseases.
yeah,
Among them is
malaria.
malaria.
Okay.
So, and the malaria test is simple. Just there are kits that they are available in some pharmacy with maybe the presence of an auxiliary nurse. They can run the test when they are sure they begin. So
So now, how do we treat?
there are drugs that we may not be able to be mentioning them, but
Okay,
quite
because they are not
but
over the
usually
shelf, or is it over the counter?
some are prescription only,
Okay.
while some are
Yes, but you don't want to start advertising for people now.
while some are something that can be gotten over the counter.
Okay.
So they call them OTC. And majorly the most commonly used now is the artemisinin based combination therapy, HTT. And you see them in a lot of names, artemether, the injectables, the tablet, the syrup, and the rest. The important thing is people should go to the right channel. We are not encouraging people to go to the quack, that they will start doing what they call combination and all this, the name.
Add this to that, and then add this, join them. Yes, but we have some people. I don't know if I should call them chemists, or you see some people carrying trays of drugs, and they put it on their heads and go about hawking it along the streets to sell to people. People do, yes, patronize them too.
See, drugs are active and potent, substances that, under certain conditions, they go through some reactions that changes, their nature. So just imagine, under ultraviolet ray,
Yes,
a
it's
product can just change, can start degrading and forming even what is dangerous. So it is advisable that the government do more of enforcement. Drugs are not meant to be hawked. They should be seen as chemical and reactive substance that are meant to be kept under certain environmental conditions, such so that the effectiveness, the safety, is can be maintained at all times.
Okay.
So they are not the type of people that we should even buy anything from, not talk of treating you, asking them to treat a serious disease like malaria.
Okay. Can we treat malaria with herbs? Some people patronize Mama Lago and all that. Can we actually patronize them in briefly?
I know that nature is there are natural, substances that and even leaves and roots that are, that contain potent anti-malaria.
Okay.
But I would not be an advocate for Mamalago.
Okay.
But those ones that have been tested, done and certified by regulatory bodies like NAFDAC and whatever regulatory bodies, then I cannot run against them.
Okay. Thank you very much, Pharmacist Bakari. Can you give 1 or 2 words of advice to our viewers and listeners at home?
That health is wealth. That we must make sure that we take care of our, health, because that's the most important, asset that we have. Today, we are able to do this because we are healthy. We are able to go to work because we are healthy. Because once one is down, productivity is affected.
Yes.
So looking at it from that angle alone, one should know that health is actually wealth. Take care of it. Thank you.
Can you just tell us your name once again for those who just joined us?
Yeah, my name once again is Pharmacist Bakari Abiodun Taufik.
Yes, you're welcome. Well, we've had it from the horse's mouth, and I'm sure you have all enjoyed listening and you've gained something from the Health Talk with Pharmacist Abiodun Taufik Bakari. It's been a good time chatting with him. My name once again is Christy Doyin. It remains unchanged. See you next week, as we call it. Bye-bye.
Ayá ìròyìn àsìkò tí ó lábùlà ẹ̀tẹ́ tí ẹ gbọ́ wá. Webcast channel ní tiwa, Webcast channel ní tiwa, Webcast channel ní tiwa, Webcast channel ní tiwa, wọ́n gbọ́ wá kárí ayé o, alágbogbo ayé já. Webcast channel, hitting the airwaves in style.